Hello, you've been diagnosed with chronic mesenteric ischemia. Let's talk about this new diagnosis for you. What does it represent for you? Why does it happen? Chronic mesenteric ischemia is a lack of blood flow to the intestines. While it may not bother you every time or all the time, it typically becomes exacerbated or worsened when a person tries to eat. What ends up happening is that in an attempt to digest food, you want more blood flow than your body can supply. This is usually caused by blocked arteries in the abdomen. When this happens over a longer period of time, you can find yourself losing weight, may even become over the long haul malnourished. But most importantly, what typically one complains of is pain. Pain even in anticipation of food, and certainly pain once one has eaten and tries to digest food. It's interesting that it doesn't always happen with every type of food. It can be exacerbated by meals that, if you will, are a little more challenging to digest. Higher fatty foods, for instance, solids as opposed to liquids. But many of these variations can be very individual rather than specific and typical for everybody. Now that you've been diagnosed with chronic mesenteric ischemia, it's interesting to think about some of the treatment options. Treatment options are typically divided into three basic phases. The medical management, which is a conservative series of treatments aimed at minimizing the symptoms, changing the risk factors which have led to the development of such disease, and preventing exacerbation of the symptoms. There's a minimally invasive series of treatments, the endovascular options, if you will, and finally there are surgical treatments. Let's talk about the medical management of chronic mesenteric ischemia first. Typically the patients who end up with mesenteric symptoms are in the same risk group that patients who develop coronary artery disease, carotid disease, or peripheral arterial disease find themselves in. These are all associated with high blood pressure, diabetes, high cholesterol, and in some cases chronic kidney failure. While some of these risk factors can't be modified, others certainly can, and it's incumbent on physicians to work hard to accomplish this. Blood pressure control is vitally important, as is diabetic control. And modification of cholesterol both through diet, exercise, and the use of medications is a vital part of any management of chronic mesenteric ischemia. Ultimately, however, once a patient becomes symptomatic with mesenteric ischemic symptoms, they usually end up needing some form of treatment or intervention. Let's talk for a brief minute about the type of evaluation that needs to happen in such cases. Most often, a less invasive type of test is ordered first. This can include both ultrasound, where a probe is rubbed over the abdomen or flank in order to look at the blood vessels and assess blood flow, or more often, a special CAT scan called a CT angiogram, which is able to assess blood flow in the aorta, the main artery in the body, and its branches. The celiac, the superior mesenteric artery, and the inferior mesenteric artery, the vessels that are usually implicated in chronic mesenteric ischemia. When indicated or when appropriate, a patient may also be subjected to an angiogram. In such a test, a small catheter is threaded through the artery in the groin most often, or sometimes through the arm, and it's positioned in the abdomen where contrast injection allows the physician to essentially make a movie of the blood flow and carefully isolates a place where blood flow may be narrowed because of plaque buildup. Once the diagnosis is made, one can evaluate the treatment options more effectively. Typically, it's attractive to look at the endovascular option first. It's less invasive, it's associated with a shorter hospital stay. Sometimes it can be done on the same day. The real issue is it the appropriate treatment for you? Endovascular treatments are generally performed for more limited disease. If the narrowings in the arteries are relatively short and they can be treated with balloons and stents, this is an effective way to restore normal blood flow to the intestines. When one thinks about the endovascular treatment, one likes to think also about what the risks might be of such an intervention. And we really worry about bleeding and clotting as the major issues in any endovascular treatment. There's always a danger of damage to the artery in some capacity because we're actually opening up this plaque and putting a stent in place, but really these are relatively infrequent occurrences. The result is usually improved blood flow very quickly, and you should be able to get back to your usual activities within a day or two. You'll find yourself eating with less pain and discomfort almost right away. It's very important, however, to, if one hasn't been eating well for a long period of time, to build up gradually so that the system isn't really overwhelmed. And follow-up both with the primary care physician and the vascular surgeon is vitally important. There's a possibility of having repeat narrowings at the site of angioplasties or when stents are used, and this can be carefully monitored by the physician both with ultrasound and CAT scan. When endovascular treatment isn't right for you, it's usually because the disease is more extensive. The vessels might be particularly small, or sometimes it's recurrent disease after an angioplasty or stent has resulted in failure due to repeat narrowing. In such cases, the bypasses are typically performed. These bypasses most often originate from the aorta, but a variety of other options exist as well. The bottom line on these bypasses is that they're actually big operations. They entail some risk, both from a heart standpoint, from a bleeding standpoint, and from damage to all the adjacent structures. But the biggest thing is really they require a longer hospitalization with more involved care. That's why typically they're only done if a less invasive treatment can't be undertaken. When you're hospitalized for such a procedure, you're typically in the hospital for 3, 4, 5 days at the very least. The bypass can be done either through the flank or through the abdomen, and most often a prosthetic graft will be used. It's not uncommon to have a stay in the intensive care unit after a bypass of this type. And nutrition might be delivered initially intravenously until the bowels are able to recover adequately. It may be a situation where if a patient is very malnourished, intravenous nutrition may even be necessary ahead of time in anticipation of a bypass, although such instances are really quite infrequent. After the surgery for mesenteric ischemia, it's typical to feel weak and maybe even a little beaten up for a number of weeks. Your hospitalization can be longer if you don't recover as quickly as expected, and even at home, you're going to be slow to get going again. It may take weeks or even a couple of months before you feel like you're able to regain all your usual activities and energy level. It's incredibly important to continue monitoring what you eat, to watch your weight, and even to record, in some cases, a diary so that appropriate progress can be determined. Whether you've had either an endovascular treatment or a surgical treatment, follow up both with your primary care physician, your surgeon, and in some cases your cardiologist is going to be vitally important. Your surgeon is going to be most interested in how you're progressing from a symptom standpoint. He's going to look to see whether or not you're eating well, whether you're gaining weight, whether you've resumed all your usual activities. Studies are going to be done in the office, including ultrasound, in order to look at either the stents or in some cases the bypasses in order to make sure that the blood is flowing well. It may be necessary to get additional testing if there's some suggestion of narrowing. Your primary care physician and your cardiologist will be monitoring you very carefully as well. The risk factor modification that we talked about at the start of this video remains vitally important in terms of maintaining your general health, but also in terms of keeping your revascularizations open.